What a great pleasure for African Ascent once again to bring you luminaries from Berklee College of Music, which I have repeatedly and quite correctly referred to as the world-leading college for the study of contemporary music. My viewers out there are so conditioned to expect that African Ascent is going to draw out from the particular stream of liberal arts professors, since that is essentially what I have been doing for the past 1 year now. But then I realized that what African Ascent has not done, but which it will begin doing quite consistently now, is to draw from the mainstream, namely the great musical tradition for which Berklee College of Music is known for. So by way of consummating that particular goal, African Ascent is honored to bring you a very engaging and discovered as a highly intelligent professional and professor at Berklee College of Music in the Department of Music Therapy. Her publications are legion. She's a prolific writer who has published in highly visible refereed journals, as well as journals that cater to the interests, passions, and interests of the general public. She also continues to do some tremendously important work with correctional facilities, children at risk, and individuals who have undergone through pain, trauma, anxiety, and suffering of all types. I particularly consider myself to be quite lucky to bring you a hands-on professor of music to talk to us for 1 full hour on the virtues and challenges of what it means to be a professor of music. As everybody knows, the great Athenian philosopher Plato, in his ideal city, gave us a vision of what he called the organized self, the morally organized human being, whom he thought needs to be capable of balancing and harmonizing. These are musical constructs, these are musical ideas of the relationships, internal relationships, that is, between reason, desire, and spiritedness. The Bible, too, as my audience knows, challenges us, advises us to rejoice in the remembrance of the transcendent God, that is, Allah to others, the Buddha to many, many others, by and through music. What a great pleasure then for African Ascent to focus its visual attention on music, its practices, its challenges, and its missions with Professor Peggy Codding from Berklee College of Music. Welcome to African Ascent.
Thank you so much for having me.
So I'm already excited because we're going to talk about one of the most exciting human powers, and the workings of which very few people understand, namely music. What I thought then, if you concur, we could begin is by discussing music globally. How is it that other traditions, other rituals, and other cultures interact with music when they want to use it for therapeutic practices? To cut it short, I would like us to talk about global music and therapeutic practices. What do you think?
Well, as you know, as a philosopher and as a well-traveled man, we know that all cultures experience music and have for all time, and that when we go to any culture historically, we find that music is there, art is there, and that that it's present in all cultures. One of my experiences of that personally is in this country, but in experiencing the culture of the Anasazi, who were an early culture of this country. Many people of this country would probably know that culture by looking at the Carlsbad Caverns, or looking in the Southwest and thinking of the cultures of the not rightly named Indians, but people think of them, the native peoples, of earlier times who built the cliff dwellers. And before they lived in the cliffs, they actually lived low to the ground. And they built very small, humble, often round, circular abodes with covered maybe by skins and but low to the ground because of the wind, and held in those houses many people in their extended families. And so you think, well, what would people bring to that environment? What would you take in living with that many people in a very small place, close to the ground, in an environment that is not really conducive to living, with the winds and the cliffs and so on? But in all those places of living at that time, we found spaces for drums and art on the walls. And so with very little space to live, people had their music in those ancient times. Mm-hmm. And if you go to Japan, you will find that a similar people existed in those early times. And again, that you'll find in those very small spaces that there was always evidence of the drum, always evidence of music. Again, the flutes that we're finding around the world now, very ancient instruments, that music has always been a part of us, because music is a part of us. It comes from the soul. It is our voice. It is, as we've spoken, you and I, it was there perhaps before language, or existed as language came about.
I see. And now, while I was reading this brilliant article that you co-authored with Susan Hanser,
right,
there is a moving chapter, a moving section within the chapter that in detailed format analyzes the relationship between the brain and music. I tried to read it. It is beautifully written, but it is so technical that I felt overwhelmed. I'm just wondering if you can break it apart and present it more legibly for us. What is the connection between the activities of the brain and music?
Well, thank you. Well, we can speak of it very technically. And you're right, some people don't necessarily want to know so much about it. Yes. But I guess a way to really bring that out in such a way that we can handle it is to say that initially, when we think about music, we think about it as soul food. It feeds our soul, it comes from our soul. But that it also, as we know now, has very definite physiological effects.
I see.
That it affects the cells, it affects our cells, and that our bodies, that we now are able, through our current technologies, to look at that through PET scans, through MRIs, that are now able to see into our brain. We can see through changes of color that those scans allow us to observe that there are changes that occur when we're listening to music. And so we're now beginning to observe what those changes are. Some of those we understand, some of them we don't necessarily understand. But we do know, to make it a light discussion, we do know that that music affects us in terms of our endorphins, which are the same chemical changes that occur when we run, for example,
I see.
and that make us want to run more. Mm-hmm. Music changes those same chemicals. Music changes our cortisol levels, which are the chemicals in our body that occur when we feel very stressed. We want to reduce those levels, and we want to increase the endorphins, and those happen physiologically. And how does that work? Well, we could have a very long conversation about that, and we're just really learning about that. But one of the things that we do know is that music affects our feelings, and our feeling part of the brain. It affects our amygdala, the base part of our brain. Mm-hmm. And we could have a longer discussion about that, but it affects our feeling self, and then also can influence our intellectual self. And how might that, if I may, be important to us? Well, one of the things that I work with in my work, and something that I'm very interested in, is trauma survivors. I think we're all interested in that, because you can't live really to our age and stage, or mine at least, and not have experienced some level of trauma. We all have in some form.
All of us. Yes.
And so how might music be used to affect the brain in such a way to perhaps help us reduce trauma? It's a very difficult kind of thing, especially early trauma. The earlier our trauma, sometimes the more we're affected by that. And so very often we find that as individuals, we go seek help. We might seek some kind of therapy, talk therapy, that kind of thing. One of the things that people do is seek music therapy. And why would they possibly do that?
Yes.
For trauma, we often tell our story. And we go home, we say, well, that didn't quite feel quite right. Music enters the feeling part of our brain. So it enters the amygdala.
I see.
So if I maybe I'm not saying this very well, maybe
Yes.
I do songwriting.
Okay.
So maybe if you're my client, we talk a little bit about your story, but maybe I don't want to ask you directly what really happened to you. But maybe we pull out through a little bit of time together, but not so directly, some words or some music, and put that together, and it comes out a little bit as a song, a little bit more indirectly, that maybe we write together, that we both contribute together to. That song, more indirectly, more peripherally, is felt in the amygdala of our brain. And it also then routes through the more frontal part of our brain as well, our more thinking part of the brain, but not so directly. So I'm not so traumatized.
I see.
I engage both the amygdala and also the frontal cortex together, and it's not such a traumatizing thing.
I see. I see.
So the music therapist will work with the feeling part of the brain and also the thinking part of the brain, and bring them together in a more peripheral way, so that both the feelings and the intellectual part of the brain is engaged, so that the trauma may not be perceived quite so forcefully, perhaps. Mm-hmm. The story needs to be told, but sometimes when it's told through music, it is physiologically perceived less, in a less difficult way, with more of the endorphins, less of the cortisol.
Mm-hmm. While I was reading this article that he co-authored, I couldn't help but imagine what is it that a professor of music therapy studies at a university setting as a PhD from the Florida State University. I believe you majored in and you specialized in music therapy. I kept on wondering while I was reading, because you also speak very much like a medical doctor.
Well, not really.
Did you also study then medicine, certainly biology, and so on, to specialize in music therapy? How does one get to be a music therapist, is my question, I think.
That's a great question. Well, as you know, at Berklee College of Music, we have one of the largest music therapy programs in this country, certainly. And we have a bachelor's program in music therapy, and it's possible then also to do a master's and a PhD. So if I may, I'll speak a little bit to the bachelor's program first, because that's really a foundation of our program. The bachelor's program is a 4-year program of undergraduate study in music. So our students are, first of all, required to be wonderful musicians, and they come to Berkeley and are required to enter as a really accomplished, musician, as are all of our students at Berkeley. Yes. And then in addition to that, they take the liberal arts courses that they take. And in addition to that, then our students are also complete a therapy track.
I see.
That involves abnormal psychology, sociology, and then for our courses, a music therapy track as well, which is very substantial. They take courses in in music and special education and exceptional children, and then they do practicum work. Our students go out and do clinical work under supervision with music therapists in the field in that area. They do training with the elderly in gerontology, and they do clinical work in the field in that area. And they study work in psychiatry, psychology and psychiatry, and they do clinical work in that area in sites like McLean Hospital, for example. They work also they do research, they learn research, basic techniques, and they study how to do that, and they propose research as well. And they have opportunities to be in facilities, for example, Dana-Farber, and learn about integrative medicine in that area and research in that, the study of research with researchers like Dr. Hanser and myself. And then they also do work with children. Wow. And in medical settings. And so they're in facilities like Children's Hospital with some of our wonderful music therapists there. And that's at the undergraduate level. So they have clinical training, and then they also have academic training.
I see.
But then they're not done. Because when they finish at Berkeley, they do another 6 months training minimum, 1,040 hours, I believe it is, of internship training that is very competitive. They have to sort of audition for those positions anywhere in the country, sometimes out of the country. And once they complete that, then they take a national board exam that will, if they complete it successfully, then they become certified as a music therapist, wow. CBMT, certified, wow. Board certified music therapist, and that's a bachelor's level. If they continue in music therapy at the master's level, then that will be another 1 or 2 years of training, perhaps at a specialty with more research, depending on what they want to do.
Amazing.
And then if they continue beyond that into doctoral training, then that will continue to inform them in clinical areas and also in research in music therapy.
So perhaps under the best and ideal conditions, now that Berkeley is thriving to be a major university, it is conceivable that a few years from now, perhaps under your leadership and Professor Hasner's, maybe a PhD program in music therapy could be offered at the Berkeley College of Music. We are growing.
We are growing. We're certainly discussing now where, with our great success with our current program, where that will lead us. And I think we have wonderful clinicians at Berkeley, terrific programs, clinical programs, and I think our program is very strong. I know that there are whispers about in terms of where we will go. Yeah. We're certainly happy with what we're doing, and we're talking about expansion, and I'm not sure where that will go.
Yeah.
Right.
Well, we have a very supportive president. Afghan Ascent has had the privilege of interviewing him, and he's so proud of the presidency and his vision for Berkeley. Right. It goes beyond buildings, from what I was able to surmise. Yes. He's also committed to the idea of building a powerful institution, a real university out of Berkeley College of Music. I did manage to sense this from the interview that I had with him. So now, as a philosopher, I couldn't help but wonder how it is that what you do in the classroom, about which I have heard from some of your admiring students, maintains its distinctiveness. They tell me that you're remarkable at combining the personal and the professional within the classroom setting. How do you do that, Professor Codding? It's so difficult to disclose yourself to your own students. It took me many years to learn how to do that and do it comfortably. Now I am at a point in my career in which I disclose practically anything and everything through which I could mediate otherwise abstract philosophical constructs. But then I learned that you've been doing it and doing it probably much better than me. How do you do it? How do you combine these two dimensions of our lives? We're professionals who are trained into maintaining our cool and not talk about our personal lives. But you seem to combine these two and do them well. How do you do that? I just want to learn from you.
It's a wonderful question, and one that I've thought about for many years as an educator and also as a therapist. When do we disclose when do our personal lives, our private lives intersect with what we teach? When do they, who we are, when does who we are become the example for what we're trying to teach? And as a therapist, you can see how those lines might cross, and also how they should never cross.
I see.
And I've really thought about that, and especially as my life has been incredibly interesting. It really has. And I think our lives do inform our work. They must. But then there are times when they shouldn't, because we always are taught as professors, as you know, that there is the line.
That's right.
You know, there's the line.
That's right.
You know, we are the educator, this is our student, and there's a line that we never cross. And so how do we work with that?
Yes, very difficult.
It is a very difficult thing, but I had a situation recently that that really made me think about that, because I'm a cancer survivor. And that's a good thing. That's a good thing, because many people in our world live with cancer these days. That's a message that I'd love to get out on your program, that there are many more of us who survive and live with cancer than die from it. And I had cancer during the year, and I was trying to figure out how to work through my health situation and be a professor at the same time. And I did not lose my hair in the treatment, so it wasn't that I was going to be that visible in the process. And I figured out how to be resourceful so that it didn't have to be so visible. But I did have treatment, and so I needed to disappear for little parts of the day and so on. And so I just said, okay, how does this intersect? What do I share? And what do I not share? And I decided to be very private about it. Mm-hmm. And this is, now I'm past that, but I did tell the students that, you know, I'm involved in something, that I'm going to be away a little bit during the day, and I will take care of you, everything will be fine, I'm here for you, all of those things that our students need and want to hear from us. And I did all of those things. But it so happened that at the end of that time in my class, one of the students said, at a time I didn't expect it, near the final, Dr. Codding, how are you feeling? How are you? And I thought, now I can answer this two ways, because she was very concerned, and I thought I can say I'm fine, which is what we in America do. Or I can, because I had said this comment to them earlier in the year, I can be authentic, and I can choose to be in my therapy side and use this moment as a teaching moment.
I see.
And I chose to do that. And I'm not great at self-disclosure. But I chose to take that moment and to be authentic with them, because we have that relationship in our department. And so I answered her question. And I said, well, you know, I'm doing really well. But remember that comment that I made earlier in the year to you about being involved in something. Well, it was some medical treatment. And you all gave me some great space And so I'm going to now spend a little time with you and share with you what happened. And they were looking at me a little, and I said, well, I think you're ready for this. You know, you've given me this space, you're pre-professional therapist, you've considered, you know, what it's like to be ill, what it's like to be well, what the issues are as a therapist. And so I told them that I was a cancer survivor, that I had been involved in treatment. And then I said, so, as a pre-professional music therapist, talking to a person who has had cancer, what would you like to know? And we all sat there. And we had a relationship so that they could ask. And they asked great, great questions.
I can imagine. Mm-hmm.
And I felt good. I felt that that was a moment where I could drop that, don't tell anything about yourself, and be authentic, because it had to do with therapy. It had to do with professionals who needed to know about a cancer patient and what it was like. And they asked things like, well, what was it like when you found out? And how did you handle that? And did you have music therapy? And what would that be like? What would you need if you wanted music therapy? What would you have? And somebody said, I'm not feeling great about this, and my grandmother has cancer, and I don't know what to say to her, and what would you tell me to tell her?
Amazing.
And it was the perfect moment.
Absolutely.
So I think there are moments where we use ourselves as teachers and use our lives as teachers. And it's not every day that we say everything that's going on. No, no, no. But there was that moment, and that moment was the perfect moment. The relationship was there. I was ready. I was healthy. And they asked the perfect questions, and the context was right. And we put a little bubble around it, and there it was.
That's remarkable. And this really reinforces on a shallower plane my own struggles with insomnia. I am an insomniac. Once a month, I couldn't sleep for 3-4 nights in a row. And during those moments, if I could do anything at all, which I think I've been doing well, is writing. I'm a writer, professional fiction writer. I can get up in the middle of the night and turn out reasonable short stories, which sometimes turn out to be right in a first draft. All that I need to do when I normalize my sleeping patterns is attend to the craft, the grammar, the flow, so forth and so on. But the story as a story sometimes, some of them at least, come out in not very bad forms during moments of insomnia. What I couldn't do as well is speak. First of all, my voice is soft. Secondly, it even becomes softer to the point of vanishing when I'm tired. So finally, I agonized and agonized and agonized and decided to share this with my students. So that when they experience oddities during the month, I want them to know that it's not a function of academic incompetence, but rather a function of something much deeper.
Right.
And after I shared this with them from class to class, I cannot tell you the level of research that they do on their own to heal me, to send me websites that I can visit, to suggest remedies, medicines, so forth and so on. So you're quite right. If you choose the right moment, if your intentions are sincere, if the tone is right, and if the students are right, I think there is no other venue through which you can teach brilliantly that doesn't require the combination of the personal and the public. So I thank you. I'm glad I asked this question because you essentially reinforced and taught me something about which I've been agonizing for quite a few years now. And now, this leads me to another question that also intrigues me, and I'm sure it's going to intrigue you even more. What role does compassion play in the production of an excellent therapist?
Can I ask you to define compassion as you're asking?
You're quite right. But by compassion, I essentially mean a decision that the human being has to make to extend one's own resources of kindness to a reasonable degree to another human being who might be in pain or he might be rejoicing. It really does not matter. You make a decision to extend your kindness to another human being. I call that relationship of the self with the self a compassionate relationship, if that makes sense.
It does. That is the hardest question I've been asked in such a long time. I think what came to mind when you asked me that question was, if I may take it there, was a situation that I found myself in as a music therapist that challenged my compassion, my ability for compassion. I had the great honor to work with the Ohio Department of Rehabilitation and Correction.
In fact, you were its director.
In fact, well, I was challenged, well, if I may tell you the story.
Yes.
One of the directors and the warden of that program at the time came to my office. They found me because I was chair of music therapy at Ohio University at the time. There had been riots at one of the prisons in Ohio after, I don't mean to sensationalize this actually,
It's quite all right.
After a long journey of inmates seeking really rehabilitation, seeking treatment within the facility that was overcrowded. And the governor and those on that side of the world perceived that they didn't really respond. And so the inmates had not been receiving treatment really. And these were some inmates who were severely mentally ill, along with those in the general population. And so things came to a head, and in a very difficult way. And after all of everything settled, the legal result of that was that services were mandated. And among that, music therapy, whatever that was, according to no one knew, people showed up in my office. Could you come talk to us about whatever it is you do? And I said, absolutely. And so I did. And we, through a long series of many discussions, I said, yes, let's just do this. And so I was able, through some great fortune and some wonderful people, one of them, Dr. Earl Stump, who was a terrific clinician after 30 years of work in the system there, got me into the system. A woman in a 2,800-bed facility, male facility, there I was. Do what you do, I don't know what you do, but fix this, which was impossible, of course. But we began a music program, a music therapy program. Why do I tell you that? Because these were male inmates, some of whom had not been out of a cell for more than 30 minutes for 30 years, every day. 23 and a half hours a day in a cell with nothing to do for 30 years. For 30 years. And they were angry. They were angry. And there I was. And they hadn't seen a woman except an officer in 30 years. And there I was with a guitar and a drum and, who are you to be in my life? Who are you? And so I was around. We brought 400 men from all over the state of Ohio who were severely mentally ill into a big, area. that was all cells and all metal and all cement, and there we were, you know, and it was a tremendous opportunity for us. But there we were, a group of angry people, and one or two musicians. I was able to bring someone in. And so my sense of compassion was challenged because I, one, didn't have enough of it, and two, who was I to even afford compassion? What was that in that kind of setting after this, where there had been no art, there had been no music, there had been nothing. So to share, if I may, a short story.
Please do.
About this, to give you a sense of that. So a colleague and friend of mine, I asked to come into the prison, and he was a tremendous world-class cellist, as it was, and I asked him to bring his cello in, and we had to get all the parts in, including the in pin, which they didn't. If you know what that is, the in pin is the part that holds the cello to the floor, so it can be. And they didn't want that in because it was a dangerous weapon, but we finally got it in.
Amazing.
Through all of the gates into the, there are many large metal gates that bring you into an old prison. And there we were in this metal and cement area. If you've ever heard those gates close, you'll never forget the sound. And there we were. And I said, they would not let any of the inmates out into the common area yet. Nobody could still get out, even though we were there. I said, let's go around and let's just play. I had my guitar, it was strange, he had his cello. Let's just play. So we went to the first cell, and there was a man in the cell, and he was sitting way at the back of his cell. He only had a blanket, no clothes, because they had taken his clothes because he would harm himself. Sitting way in the back, it was kind of dark. He was an African American, so there he was, way in the back, in a very white blanket. So he was a very distinctive looking person. And I said to my friend, I said, would you just sit here, and you know those Bach suites that you play, and I don't know if you know the Bach suites, but they're Bach unaccompanied suites, and Yo-Yo Ma plays them all the time in Boston. And so my friend Mark sat and he played one of the Bach, one of the first Bach unaccompanied suites, a very beautiful piece, just mellow and slow. And you could hear around us people clanging, and there are people up here in cells, and people here, and people here. And it's still kind of loud, and here this one solo cello just playing. And he ends, and this man just kind of scrunched up, moves to the front, and he sits right here. And he still doesn't look up. I said, Mark, play some more. So he plays again. He plays the second movement. And at the end, this man kind of looks up. And we're aware that it gets very quiet around us. Still thinking about compassion. It gets very quiet around us. And from way up, way back here behind us, I hear, that's the second movement, and do you know the third?
Wow.
It was so quiet. And so I say, well, in a situation like that, it wasn't, and this man in front of us, it was just one tear. And the people, I look around, and the people in the cells beside were just hunched up in the corner of the cells. It was unbelievable. And that story comes to mind when you ask me that, because there wasn't enough human compassion. There weren't words that could be said. It was just the music.
Absolutely.
It was the music that only the nonverbal moment and the cello that could bring enough compassion.
That's right.
To those people in that room.
Absolutely.
Nothing could be said. There wasn't enough. There were no words.
There was no need for saying
And there was no need for words, only music.
I'm glad I asked the question. I learned so much. And now, I would like us to talk about cases. Choose any case that you think
Yes.
continues to play a prominent role in your profession, which you would like to share with the public?
Mm-hmm. Well, since my mind is there in that setting, if you don't mind, though I work with children and love to work with children, I'll stay there because that environment is one that, the correctional environment is one that we don't often really think about in terms of rehabilitation. Our correctional settings, people are kind of lost souls. And it's the one that comes to mind as being challenging. I worked in this setting of severely mentally ill inmates for some time.
Okay.
And I'm sorry that that's the one that comes to mind because most people like to hear about children and that's probably where I should go, but this is the one that comes to mind. And the issue of that population in corrections is a very challenging one because when we talk about incarceration, we talk about people being removed from society into correctional facilities. That is the punishment. What do we do with them when they're there? You know, we're not really supposed to punish them further. So what do we do? Do we rehabilitate them? People eventually leave those correctional settings and become our neighbors. They do. So we want them, in my thinking, as a therapist, those are the glasses I see the world through.
Yeah.
I should want that person to experience life and to be able to better themselves and reduce the anger and get, if possible, some level of insight. So put that thought there. And then secondly, that music, I guess, can be used to do that, and we ought to do that. So here's my case. I was working in a group to use music for anger management, mm-hmm. which is a big thing in correctional facilities. Yes. Mm-hmm. And there was a person who was in this particular unit who would lie on his bed in his cell, which was very open, with his coat over his head every day.
Wow.
Just lying, and all I could see were his legs and his feet. I never saw this person, I just saw his coat. And I said, who would live their life in that way?
In that way, every day.
If you just think about humanity, you just think about a human being, whatever
right.
they are, who would be forced to live life that way? So I was intrigued by him, because I would need to walk by him every day. And so I had an interest in him. I just, who
is this human
Who
being?
is this human being? This is a human being. And so I worked with an art therapist. And they're great people. And we trained them at Lesley, wonderful program at Lesley University, who decided that he would learn about the people that we worked with, and he would draw pictures of their lives. And he would, just their stories, in such a way that they could fill in those stories with colored pencils, which we had to get in. And so I dropped off some colored pencils, and I dropped off a story, somebody's story, just by his cell. And started dropping off things.
Gradually.
Slowly. Nothing.
No response.
No response. But then one day there was a response, and he just kind of, the coat was gone, and I noticed some of the pencils were gone. And so gradually you can get sort of the story.
Amazing.
And one day he was sitting outside of my cell. I had a cell too, which was my office.
Uh-huh.
And he was just sitting there. And then one day, so this gradually moves, one day I almost dropped a guitar, and he grabbed it.
He grabbed the guitar.
Instinctively grabbed my guitar. And now he was stuck, because now he had a relationship with me.
Amazing. Through the guitar.
Through the guitar, because he had it right there. And that was the beginning of our relationship.
Amazing. Amazing story.
And he never talked to me. In 4 years, he never talked to me. But he came and he sat with me, and he would hum. But that was the beginning of our relationship. He eventually would come and sit in my groups.
Amazing.
Yes.
Amazing. Amazing.
And so he was severely mentally ill.
Mm-hmm.
So I guess I would say to you is that what that story might mean, whether it's a person who's severely mentally ill, and he had quite a history, or a young child, or an older person, a person in a coma, sometimes, not always, that music can be an amazing connection, that it reaches the brain, at the base brain,
To return to our
the amygdala,
yes,
that it enters, and sometimes it makes connections in places that we don't anticipate, that, as one of my colleagues says, it's a place where we meet.
amazing.
It's a place where we met, and it moves from there.
I'll always remember it. In fact, I may plagiarize your story.
Please.
And write a short story.
Please do.
And then I'll send you a copy
I would love
to see
that.
how well it's done.
I'd
Thank
be-
you so
I'd
much
be
for
honored.
sharing this with me. And now, again, I'm so intrigued by that well-written article that you and your colleague wrote. I learned a lot from it. There is this section there on pain, on traumas, on stresses, diseases of all kinds, which seem, on your point of view, could be healed through music, if not exclusively, through an integrated fusion of appropriate medicines mediated through music therapy. I would like to know more.
Thank you.
How does that work?
Well, one of the things that I will say is that we are not at a point that we would love to be, where music would be the great healer. It's clearly not a healer. It does wonderful things in the world, but we must rely on our physicians to do the great work that they do. But it is what we call part of an integrative medical model that music does contribute when used effectively by a trained music therapist in a medical setting. It can do many things. It can, one of the things that you spoke of was pain or pain management. And certainly there are some things that we know about that. For example, that we're able to use use music as a distractor from pain.
I see.
And there are ways that we do it, and it's effective in some settings more so than others. Let me think. Let me get my brain here where I need to go, and that way. There have been one of the things that we do in music therapy that is the basis of our work is research. One of my wonderful professors began doing quite an extensive bit of research in music and medicine to see where we are effective, where music has been effective relative to pain research. And she found through meta-analysis that when you go to the dentist, that music is a great a great way to reduce the pain in the dental chair.
In the dental chair.
And that in childbirth, that music has been shown to reduce the length of labor and the amount of medication that women use in childbirth, because it seems to relax the muscles and distract. And we have the studies that indicate that.
Incredible. So let me idealize possibilities for the future then. Do you ever envision the possibility of music becoming so potent in relationship to pain that it could one day displace pain relievers?
Well, I think for some people it already does have that effect, because it can be used to increase the endorphins and reduce cortisol levels. We already have that research, which is increasing every day, so it's already having that effect.
See, already.
Right.
Well, remember, before the program began, we were both worried about the interview. Guess how much is left? How much time is left now?
Not long.
3 minutes.
3 minutes.
So I would like you to take these 3 minutes and use them in any way you want. All that I would want you to do is look at the camera and interact with the community?
Well, first of all, I would like to thank you so much for having me here today.
It's my
been
pleasure.
a wonderful opportunity for me. The second thing I would like to say, you've given me the opportunity, is to say that I am the president of the Boston Minstrel Company, which is an organization that uses music interactively in the community with the shelters. We go around to and make music with the homeless and with those at risk. And this Saturday night at Scullers, we are having our 20th anniversary gala, and we would like to invite you to come. Our tickets are $65, but it's dancing, it's a fundraiser. It's just going to be a great event, and as it always has been. And so it's this Saturday night at 7:30 at Scullers. It's going to be a terrific band, terrific dancing. It's a great party, and we'd like to invite you to come. So we'd love to say that. Mm-hmm. Thank you very much.
And of course, you can also, I think we have a few minutes more left, if you like. You can also talk about the program at Berklee College.
I would love to talk about the Berklee Music.
We have 2 minutes left.
Okay, I would love to talk about the Berklee Music Therapy program. We have, Berklee, as you know, is a world-class contemporary music school located in Boston, Massachusetts, and the music therapy program has been in existence there now for 15 years. We have, it's music-based. And as you heard earlier in the program, it is a challenging program, but our students leave our program and become music therapists now all over the world. We have students who come from all over the world. I think about 40% of our students are international, and we're delighted with that. And they are extremely talented as musicians and extremely talented as music therapists. We're very proud of them. And 25 of them are about to graduate this year. We're happy about that and also sad. And we would love to invite you to come, any of you, and see our program, see what's going on. There are many events at Berklee in our music therapy program, and also, if you don't know, about 1,000 performances, music performances at Berklee every year, and many of them are free and open to the public. So we'd like to invite you to find out more about Berklee School of Music and in particular the music therapy program. I'd like to thank you so much again for having me and for allowing me to share about our program. It's been a great delight. Thank you. Of course.
And this is only the beginning of a very ambitious series that African Ascent will be working on, that will focus on drawing out the contributions of musicians, performance studies, music theorists, and many, many others. As I promised my audience, this was fated to be a memorable program. Indeed it was. This is Theodoros Skiros for African Ascent. Good evening.